Hello, everyone. I'm Saad Omer. I'm the director of Yale Institute for Global Health. In addition to YGH, we are indebted to the Macmillan Center at Yale for co-sponsoring today's event. It's an honor for me to introduce today's guest, U.S. Senator Chris Murphy. Senator Murphy has been a strong voice in the Senate, fighting for job creation, affordable healthcare, education, sensible gun laws, and a forward-looking foreign policy, including, and of particular interest to us, global health. As a member of the Foreign Relations Committee, the Health, Education, Labor, and Pensions Committee, appropriately abbreviated often as the HELP Committee, and the Appropriations Committee, Senator Murphy has played a key role and continues to play a key role in policymaking around critical global health issues. For example, he has introduced the Global Health Security and Diplomacy Act, GSDA, a legislation that is geared towards better detection, deterrence, and containment of infectious disease outbreaks overseas before they become global pandemics. As we will learn more today, he was an early champion for a very robust response to the COVID-19 pandemic, and he has also advocated for a range of issues in global health, including primary care, tuberculosis, and many other issues. We initially had the intention to have an hour-long program. However, given the deliberations that are happening in Congress around budget reconciliation and other issues, i.e. Senator Murphy's day job, our conversation today will be around 30 minutes. While we won't be able to take audience questions today because of that change in time, I'm looking forward to a great discussion nevertheless. Welcome, Senator Murphy. We are so pleased to have you with us today.
Dr. Omer, thank you very much. I appreciate you accommodating my schedule here. It is a very busy week in the Senate, but this is still part of my day job, working not only on continuing to improve the United States response to COVID, putting ourselves back in a leadership position globally to help other nations respond, but also to communicate what we're working on to people in Connecticut and around the country. So grateful for this opportunity and looking forward to the conversation.
My pleasure. So to get us started, can you give us a sort of a big picture view of how the US Congress responded to the pandemic and how it has evolved, this response has evolved since the early days of 2020?
That's a important question with a probably hour-long answer, and so I'll give you the very abbreviated version. As you mentioned, I was one of the earliest critics of the Trump administration's laissez-faire policy towards coronavirus. Early on, as we all remember, they were making claims that it would be dispensed with in a week or two, and put essentially all of their eggs in one basket. That was the travel restriction basket. Instead of requesting early emergency funding from Congress in order to start building a robust supply chain and training local hospital and public health staff around how to deal with early infections and the early need to track and trace, they put in place what ended up being a feckless set of travel restrictions that ultimately was easily pierced by the virus. Congress and Washington has a deserved reputation for being defined by gridlock and stalemate. I will say 2020, an election year, was a time of pretty incredible bipartisan compromise. On 6 different occasions, 5, 6, 7, half a dozen separate occasions, Congress came together, Republicans and Democrats, to pass significant bipartisan legislation to address the coronavirus crisis. President Trump didn't lead, Republicans and Democrats in Congress led. And so the reason today that you have small businesses that are still standing, the reason why schools were able to reopen, that's because Congress passed legislation from the CARES Act through to the December legislation with both parties on board to respond to the crisis. Not coincidental to the election of Joe Biden, politics started to creep into the question of how the political class talked about coronavirus. we were largely together through 2020. But all of a sudden, when a Democrat came into the White House, Republicans started to raise new issues about vaccine policy and mask wearing. And now, unfortunately, many parts of the country are divided along political lines as to whether we should follow doctors' advice. And that is a failing of our political system. In Connecticut, I think we've been lucky that, well, you still find politics. There's still a crowd that doesn't want our kids wearing masks in school. By and large, Republicans, I think, in Connecticut have been, at the table, responsive, thoughtful. And I think that's part of the reason why Connecticut leads the pack nationally when it comes to vaccination rates and remains at the bottom of the pack when it comes to infection rates. So Congress, I would argue, had a pretty good 2020, has not had a very good 2021 in terms of bipartisan cooperation on COVID. And as we'll talk about, my hope is that we recognize that we have to walk and chew gum at the same time. We've got to protect ourselves against the current strains of COVID while standing up a global infrastructure to identify new strains and future pathogens. And that's a lot of the work that I'm engaged in on the Foreign Relations Committee. And frankly, Dr. Omer, we've been very grateful to have your advice and counsel on many of the pieces of legislation that we've been working on here. I'm grateful for our personal partnership.
My pleasure. And thanks for highlighting that, in democracies, these levels of initiatives and response to crises are inevitably political, but they don't have to be partisan. And I think we are all served by sort of broad engagement on some of these major policy issues. And you have also been a champion of efforts to reduce the impact of misinformation and disinformation during a pandemic, but broadly around health as well. What do you think we can specifically do in this area of reducing the impact of misinformation and disinformation?
Well, listen, as we all know, the difficulty of getting square information exists beyond the health realm. I was 2 weeks ago engaging in my annual walk across the state. I take about a week every year, and I walk from one end of the state to the other. And I was walking through Middletown, stopped to see an older gentleman who was sitting on a bench, I think waiting for a bus. And we got in a really fascinating conversation. He was a Trump voter in 2016. He was a Biden voter in 2020. He's not particularly partisan or political, but his biggest worry was where he should get good information. He doesn't trust any information sources these days. He misses the time when there were only 3 news broadcasts, when he thought that news was a public contribution of the networks rather than a source of profit. And so this is a question that a lot of Americans are having. Of course, when it comes to health misinformation, it's deadly, right? You get the wrong information about politics, maybe that causes you to cast an ill-informed vote. You get the wrong information about your health, you may not survive. There's a Pew Center study suggesting that about half of the American public reports having consumed some amount of misinformation, fraudulent health information online. And all of us who have run into an aunt or an uncle or a friend who tells us that you're more likely to die if you get the vaccine, we know how easy it is to pick up that information. So I really think it's time for a big investment in health literacy. And I don't think this is a particularly complicated endeavor because, there are a handful of very trusted sources, both public sector and private sector sources. And engaging in a public relations effort to just generally try to explain to people which sources they can trust and which sources they can't, I think that would be really constructive. So I'm building legislation right now that I've consulted with you, Dr. Omer, on. I'm trying to win some bipartisan support for it that would push this public information campaign around where to get your health information from. And we also, of course, are in a constant dialogue with these social media outlets. It won't surprise you that Senator Blumenthal and I are not satisfied with the degree to which the big platforms like Google or Facebook have policed misinformation. I mean, I'm watching Facebook ads on TV right now in which they're basically defending their right to put lies on the internet. And I think that's just devastating for democracy, but also devastating for our COVID relief efforts.
So switching a little bit to sort of last year, and I'll combine a couple of questions together in the sense that last year, as part of our response, the US response, there were a lot of efforts to push for utilization of the Defense Production Act and some of the other interventions to improve not only just domestic PPE supply, personal protective equipment supply, as well as make sure that our allies around the world had PPE and therapeutics to reduce the spread of COVID-19. What did those efforts look like, and how should we think differently about our supply chains going forward? And if you want to elaborate on how you and other members are approaching sort of broader response to the pandemic, perhaps you might want to combine that as well. But I'm interested in, in the context of the Defense Production Act and some of the sequelae of some of those events.
Well, first of all, the utilization of the Defense Production Act for pandemic response is very much like trying to take a square peg and fit it in a round hole. So while I have been amongst the most vocal proponents of utilizing the DPA, we just have to remember the DPA is a sort of wartime initiative to give the President of the United States the ability to commandeer industrial resources in order to make airplanes, right? Or whatever you need in order to fight a foreign enemy. It was not designed to produce masks or syringes. And so, now that we are getting to the point where we can have some 2020 vision on 2020, we should be thinking about rewriting a version of the DPA specifically tailored for health crises. One of the things we found in 2020 was that the utilization of the DPA was a mess, largely because Donald Trump was a mess. He put it in the hands of his son-in-law, who had no experience running big supply chains, but also because it inherently asks the Department of Defense to take a primary role. The Department of Defense has no experience in building these kind of supply chains. And as we learned, the agencies that should have that kind of expertise, CDC, NIH, and HHS, also weren't very good at it. So we've got to sort of build a permanent capacity inside the federal government to manage medical supply chains. And yes, we need to work with our allies in order to build the permanent ability to produce the most important equipment, the most important supplies necessary. I think we've just got to make a decision that when it comes to certain items, we can't be reliant on a Chinese supply chain. That doesn't mean that, we have to be constantly, making gauze or syringes. It means that we have to have the plus up capacity, the surge capacity in the United States and our ally structure in order to meet that demand should another pandemic occur.
Wonderful. So I think there will be hopefully a lot of sort of policy changes, some introspection, and hopefully some legislation and policy interventions. Not all of them will be legislative solutions. How do we ensure that any policy changes that are made to strengthen our pandemic preparedness are maintained beyond the current administration, and the tools the tools that are developed through legislation are actually utilized?
Well, it's always a risk in a democracy that a policy adopted by one government will be reversed by the next. But I think if you look at the areas of alignment and the areas of distinction between the parties, it gives you a little window forward into where we can create policy consistency and where we can't. Right now, you see the division that exists on mask and vaccine mandates. I don't know that that's going to be solved anytime soon. But there is alignment when it comes to some of these questions we were just discussing, like supply chain. I think there's a growing agreement inside the Republican Party that we need to have an industrial policy as a nation. And that belief sort of comes out of the experience of COVID, but it also comes out of the crisis we've seen with semiconductors and other critical items for the industrial supply chain. So the Senate back in the summer, maybe late spring, early summer, passed a bipartisan bill that for the first time ever really advanced a U.S. industrial policy. We actually allocated billions of dollars to help subsidize industry in critical areas so that we can compete with China. So I think if we do reevaluate some of these issues around supply chain and readiness, we can guarantee some consistency from administration to administration.
Wonderful. So you were one of the early supporters of US engagement and funding for the Coalition for Epidemic Preparedness Innovations and other similar measures. And for our sort of audiences who not everyone would be familiar with it, it was this entity created right around the Ebola outbreak, 2014, 2015 outbreak, to speed up the availability of vaccines around the world, especially in low-income countries, and have those vaccines ready for phase 3 trials after doing initial development. For a while, until very recently, until the Biden administration, there were funders of that entity that ranged from Ethiopia to Norway and Britain in between, but the US was conspicuous by its absence. I know that you have been an early supporter of that initiative and similar measures. Any thoughts on going forward? How do we look at initiatives like CEPI? Or is there anything else that comes out of this crisis that fills that gap?
Listen, I think this is a fascinating and really important debate. How to properly set up incentive structures to get safe and effective vaccines for emerging pathogens as quickly as possible. I, as you mentioned, have come to the conclusion that we need to be invested in international cooperation, and CEPI is, in my mind, the place to do that. The Biden administration has invested, but not enough. The Trump administration sort of sat on the sidelines, let others invest in CEPI. The Biden administration has jumped in, but not with 2 feet. I think we can do better. I don't think that eliminates our domestic ability to, pursue our own vaccine pathways. There's some that say, well, we shouldn't be in the business of international cooperation because, coronavirus was actually an example of how nation v. nation competition expedited the development of vaccines. That everybody knew they had to do it on their own. There was no guarantee you were going to be saved by somebody else. So there was massive investment, and you ended up with European work, US work, Chinese, Russian work. I don't think it's an either or question. I think it's a both and. I think you can both develop your own domestic capability to create a vaccine and be robustly cooperating in space like CEPI. I'm worried about some of my colleagues' ability to view this as two mutually exclusive options. So I continue to press the administration to both plus up our domestic investment in vaccine research and make a big contribution to CEPI. I don't think we can lose if we do both.
Yeah. So you have an interesting place in our legislative and policy process. So in addition to serving on the Health, Education, Labor, and Pensions, or the so-called HELP Committee, you also serve on the Foreign Relations Committee. From a global health perspective, and from a foreign policy perspective, there's a lot of, I would say, instability in the US interaction with China. Things are evolving, things are changing. We are certainly not in the early 2000s era in terms of interaction with China. So specifically, sort of keeping those perspectives in mind, health and foreign relations, how do you see the balance of competition versus collaboration with China going forward?
Well, I think the fight of the next 50 years will be between US-style democracy and Chinese-style autocracy. The Chinese believe that American democracy and European democracy is withering on the vine. They think that COVID is an example of how democracy and democratic institutions have become so sclerotic that they aren't able to adapt in order to meet new threats. And while coronavirus began in China, they would argue that their system was much more effective at stamping it out, obviously at great cost to civil liberties. And so we've got a lot of work to do at home in order to improve the state of US democracy. We have to show that our democracy can rise to meet the challenges of today, which is why the Build Back Better agenda that we're discussing right now, asking the very wealthy to pay their fair share to fund investments in the middle of America, I think that's important to our global competition with China, as our efforts to make sure that everybody in this country has the right to vote. But maybe on the top 5 list of devastating Trump era policies was the decision to withdraw from the WHO. I mean, I don't know that we will recover from that decision during the first term of the Biden administration, because China, having become the biggest player there in our absence, isn't going to give up that position of hegemony easily. They are right now the biggest contributor to many UN agencies. The UN feels that China is a more reliable donor often than the United States is. So as we try to compete with China, as we try to make sure that US health regulations, US and European health standards become the rules of the road, we've got to be present in a big way in these multilateral bodies. And so this is a time, and I'm arguing this at the Foreign Relations Committee for the United States, to double down on our participation in these organizations. That's one way that we step up to the plate on China competition.
So, as you know, that we have had cyclical interest, a boom and bust cycle of public health funding in this country. Public health departments, we were very fortunate in Connecticut for our state leadership in terms of getting the job done with the pandemic, especially the immunization program and so on and so forth. But generally speaking, the capabilities of the health departments have been eroded substantially partially because of these boom and bust cycles. Are there any, maybe it's too early to ask that question, but has there been any thinking to get out of that, to use policy levers that add predictability to some of those resources that health departments specifically, but also federal agencies like the CDC, et cetera, can expect?
Yeah, I was just having this discussion this morning in my office with Kathy Schiller, who's the CEO of the Stanford Hospital Health System. And she was talking about a really impactful model that they created and disseminated around Stanford to try to get vaccines into low-income and non-English speaking communities. They have an extraordinary success rate. And to her mind, it was a really important collaboration between the hospital, public health, the city, local health nonprofits. And they were successful in those low-income neighborhoods in getting 81% vaccine penetration, which is really remarkable, better than we've seen in many other like neighborhoods throughout the state and country. But that's because we funded that effort, right? That's because we decided to spend billions of dollars in relatively flexible funding so that Stanford Hospital could design, Yale New Haven could design public health programs that empowered public health professionals to spend the time that was necessary with people to get them into the necessary program. In this case, the program was simple, a shot in your arm. In other cases, the programs are more complicated, whether it be recovery programs or mental health treatment programs, but the tools are the same. Public health workers out there in the community working outside of a fee-for-service structure in a coordinated way. So your question is whether we've learned lessons here. I think the answer is we haven't. I mean, right now there's not the kind of talk there should be in replicating some of the models we used for vaccine distribution for addiction, for mental health, for obesity. And that's really a missed opportunity. So I'll continue to make that case. But I will say, a lot of this has to come from the grassroots up. Right now, there's so little accountability when it comes to public health. Everybody's doing it. And we just, listen, from the top down, we've designed that system, but we need some help from practitioners on the ground to say, how would we redesign this system? Right now, public health districts are doing it, city governments are doing it, hospitals are doing it, community health centers are doing it. Sometimes they're doing it together. In some cities, they're not coordinating at all. And so when you have such siloed public health work, it does make it difficult for the funders, the federal government, to decide to come in and throw more money at it. So giving us a view as to how we can build integrated systems might make the federal funders more interested in putting significant money in.
So just to wrap things up, moving forward, what will you and the Congress be focusing on to prepare for the next pandemic? Something perhaps you haven't mentioned yet, or something that you want to emphasize as we wrap up.
Well, I'd hit the highlights of our conversation, right? We've got to combat health misinformation. We've got to rebuild our supply chains. We've got to continue to try to do work to depoliticize the conversation around healthcare and science. But to finish, we've got to understand that if we're not fighting pathogens everywhere, we're vulnerable here. So we've got to make a big commitment to global public health in this Congress. I wrote, as you mentioned, the first sort of bipartisan bill rebuilding our global public health infrastructure. Jim Risch is a hyper-conservative senator, at the time the chairman of the Foreign Relations Committee from Idaho. He and I wrote this legislation together. A version of it was passed by the Foreign Relations Committee earlier this year. And we are just badly mis-resourced right now. We spend 12 to $20 billion a year in global public health. We spend $700 billion a year on conventional military construction. That is not the right ratio, given the ratio of threats that are presented to the United States. So we've got to rebuild our international public health platform. We've got to spend more money on it, because if we don't, we can build up all the prophylactics back here at home, as we saw in 2020. There's no barrier, there's no wall, there's no travel restriction that can stop a deadly and contagious virus from hitting us hard.
So thank you for a wonderful conversation. And sort of, I must say that I think we are fortunate that we have a senator who has his ear to the ground by things like sort of walk across Connecticut, and we feel fortunate. And I think you might also feel fortunate that you represent Connecticut, not California, because that would have been a much longer walk.
Yeah, and I cheated this year. I normally go east to west, which is about 110 miles, but this year, given in part the schedule in Washington, I went north to south. So yeah, I have it a lot easier than most of my colleagues.
All right. No, thank you, and thank you to the to those who connected to this call. I want to remind those who are present, our audiences, that our next conversation event will be with the Dr. Anjali Achrekar, the acting U.S. Global AIDS Coordinator and Special Representative for Global Health Diplomacy. We look forward to seeing you again soon. And thanks again, Senator.